Well, when we use cryolipolysis, what we are doing is just freezing, creating a thermal shock on our adipocytes, which creates, what we want to stimulate is the apoptosis of them. Okay, so this is something definitive. It is not reversible, and it takes 35 minutes in which we freeze them and we create this shock. Well, the first factor is once we freeze, we treat the area, is the local massage. That could be, that creates, let's say, stimulates more the shock over the adipose cell, adipose tissue, and increases on 68% the result in that area. Of course, we don't have to forget the fact that a good diet and exercise, taking care of our bodies, is mandatory for sure. Well, you know, you can treat practically with all the applicators we have. You can treat all the areas you want. Now we've lived this evolution of the applicators, and now we can treat also little small areas such as the submental areas, and we can treat the thighs, we can treat the abdomen, we can treat the back part. So with this kind of applicators, we have a very large variety of indications, so we can satisfy our patients. You know, people can, after the treatment, they can go and do their normal activities. I mean, there is no downtime. They can go to train themselves, they can go to run, they can go to make exercise, they can get their normal life after the treatment. There are no recovery times itself. Well, when we talk about contraindications, of course, if they have some kind of sensibility towards cold, that could be Raynaud syndrome, cryogravulomania, of course open wounds, hernias, etc. There are several of them, but I think that these patients, patients that come to us, rarely have a problem, because they can think on countering their body without, I mean, because they are healthy and they have no problems. So there are some of them, but if respected, we can treat a large variety of patients for sure. Generally, in this case, what generally happens is that they can feel, for example, a little bit of pain, maybe during the massage. It has to be done after the treatment, and some numbness in the area, lack of sensibility for a couple of weeks, for example. Yes, that's quite common, but I mean, it's nothing it's something that the patient can live normally with no problems for sure. The most important thing it is that doing cryolipolysis must be not an arrival but a departure. We need to stimulate our patients to take care of themselves.